Dear friends, my name is Dr. Anna Brodski. I'm an anthroposophic physician and I'm a GP, and these two roles go hand in hand. I want to talk about urinary tract infections today. And generally, when I bring you my videos, the goal is to give you some helpful tips, both from my experience and from my anthroposophic medical insights, to help you be healthier and have a better life. So let's talk about urinary tract infections. There is one very important thing to share before I go into it, which is linked with urinary tract infections, and that's elements. In anthroposophic medicine, we see the parallels. So from my previous videos, if you watched any, you know how we see the human being as consisting of spirit, soul, energy, and body. And actually, there are elements that are linked with every level. So the physical body links with mineral kingdom. The energy body actually links with the fluid element, i.e. water. And I'm not going to go in this video into the details, I just want to outline it. The soul links with air, and the I, or the spirit, links with warmth. And this is important. So the warmth in anthroposophic medicine is very important. It's really important to make sure, you see I have hand warmers, hand warmers, exactly for that reason. It's very important to make sure that the human being is actually of the right temperature, that we do not neglect the warmth organism. It's really important to dress up warmly. In the case of urinary tract infections, what happens is a sort of cooling process in the urinary tract, and keeping warm is part of it. Honestly, a lot of my patients with chronic or long-standing repeated urinary tract infections have cold feet, and later on in life we kind of start lifting out of our body. So it's like, you know, at the beginning of life we're incarnating into the physical body till we're adults, sexually mature adults, and after 30 we start gradually disincarnating. As horrible as it sounds, it unfortunately is part of our life, as death is part of our life, unfortunately or fortunately. It's all a balance, isn't it? And so when we want to prevent urinary tract infections, we want to actually warm the rest of the organism. We want to wear warm leggings. For men or women, it doesn't matter. We want to keep warm. We want the feet to be warm, because if you are cold, and often what happens, we have our habits, we are stressed and so on. We're not even aware that we're cold. It's just, you know, when I touch your hand, I will know if your hand is cold, and my hands do go cold. So I have to work on this, keep myself really warm. So first step is to become aware if we are cold. And again, this is also massive. We have been trained, you know, by education, by working systems, to completely abandon our needs and not even necessarily be able to go to the toilet for hours on end. So we don't listen to our bodies. We don't listen to our soul a lot of the time, and we need to start listening to our bodies and our soul. So we need to feel, am I feeling warm? Do I need to put some wool on? In anthroposophic medicine, it's a very common thing to do, wear kidney warmers, and all that is basically like a band of wool around your kidneys area. So your kidneys are just at the back, just behind your ribs, in this sort of, I'm sure you can't see this because you probably just see my head, but kidney warmers is a good thing. So are woolen socks and tights, and you don't want to expose like your head to the cold, because you know a lot of the time that is linked with sinusitis and coughs and colds. And children, I see so many underdressed children. Oh my god, I want to dress all of them. So the first important thing for preventing urinary tract infections is keeping warm, right? The second thing, and you already know this, but I will tell you anyway, is drinking plenty of fluids. Why? I always want to give you the why so you understand the logic. It's not like you have to believe me. The logic behind drinking lots of fluids is because if we're dehydrated, we're not producing a lot of urine. And when there is not a lot of urine to pass, it just sits in the bladder without you going to the toilet for extended periods of time. It sits in your bladder and it's more likely to get infected. So drinking, and especially in the winter, you want warm drinks to keep yourself warm, to help the eye, the spirit that needs to connect with the physical body, your spirit, to be connected with it. The minute you start going cold, it's like we drift off. We lift when our feet go cold. It's almost like we start very slowly drifting away from our feet, and then so on. You want your eye, your spirit, to be able to fully incarnate into your whole body. The other thing is hygiene. This is more for women. Everyone knows about passing urine after sex. Great stuff, sure, go for it, do it. But for some very strange reason, maybe it is embarrassing, people don't talk about something else which is even more important, and that is women have a shower downstairs before you have sex. And again, I will explain why, because once you know, you will follow this. So, you know, when we send your urine to the lab to look for infection when you have the symptoms, 99% of the time the result comes back from the lab and it shows something like E. coli. What is E. coli? E. coli is a normal bacteria in the bowel. So do you hear me? It comes from the bowel. So if you have opened your bowels and then you have sex, the chances are whatever, you know, the bacteria after opening your bowels, you cannot wipe your back passage 100% clean. It will just travel up into your waterworks during sex. This is normal. This is why having a shower downstairs, i.e. in your intimate areas, I'm just being figurative, is going to prevent like a massive number of urine infections. So that's advice number 2. Now I want to turn to men, actually. So as men grow older, they also become more prone to urinary tract infections. And a lot of the time, this can be linked with the prostate problems. And I observe that men do not pick up on this early enough. It's likely that it's very insidious and it's hard to tell. But what happens, a massive proportion of men, as they grow older, their prostate grows bigger. And what it does, it gradually constricts the urethra. And then you find yourself that you need to go to pass urine more often. You're not passing that much. The stream is not so good. You're dribbling. You're hesitating before the stream starts. And then you've just been and you need to go again. And then you also find that, we call this nocturia. You find that you have to wake up and go to pass urine in the night. Once, twice, 3 plus times. The longer, you know, you leave this problem unattended, the worse it tends to get, because the prostate keeps growing. And it's of course not all men, it's just quite a big proportion of men. So the problem with not treating prostate, enlarged prostate, is that as prostate enlarges, it compresses the urethra, and what happens, you're not fully emptying your bladder. This is dangerous, it's not a joke. A lot of the time, the bladder will accommodate a lot of urine, up to, you know, 3 liters. I have seen it, men come into A&E with retention, urinary retention, having a catheter put in, and, you know, 3 liters comes out. But this is not the end of it. So this urine backs up and it stays in the bladder. You may feel discomfort. I hope that if it happens to you, you feel it, because a lot of the time, again, we're not listening to our body, but we must. So you feel the bladder is getting bigger and you're distended. That's not all, because then this urine from the bladder, it backs up into your kidneys. So your kidneys, this is what in medicine we call hydronephrosis, when your kidneys become big because they're filled with urine. This is really not good, because this is going to start affecting your kidney function. And as you may know, as time goes on, our kidney function declines already. So why would you do anything to speed this up? So the question is, what do you do? Yeah. So like I was saying in many of my other videos, anthroposophy and mainstream medicine actually are meant to be practiced as one thing. So here I'm actually going to tell you what you need to do is to see a doctor, your GP, tell them all the problems, and you will be prescribed. There are few things we can prescribe, but usually 2 classes of medication. So something to relax the muscles in the prostate so that your stream can be improved, right? So that the urine doesn't back up. And the way this links with infections is of course, because if you're not passing urine, normally it sits there, of course you will get recurrent infrequent infections. So the prostate is the problem here. So you see your GP, they prescribe you this tablet. It does take about a month to work, so don't despair, but then you should see an improvement. If you still feel you're not emptying your bladder fully, you actually need to go back to your GP, say it's better but not 100%, then we can prescribe a second tablet. The second tablet, finasteride, works in a different way. It stops the androgen or the testosterone from kind of growing your prostate, so it blocks those receptors just specifically in the prostate. I don't have many patients who have complained of side effects from either of this tablet. And that tablet works slower, so that one may take a few months to kick in, but then you should feel better. And if you're not, then just let us GPs know, because the next step is to refer you to a urologist. And I am pointing this out so that this can be treated earlier, so that you're not going to walk around with distended bladder, so that you're not going to get multiple urinary tract infections. Just don't ignore these symptoms, because this is all treatable, okay? And if the worst comes to the worst, there is the operation. And again, in anthroposophic medicine, we have nothing against operations. In fact, it's part of the treatment. So a lot of the time, it's better to reduce the size of the prostate than end up with multiple infections, risk of sepsis, and a kidney failure, because the urine backed up and ruined the kidneys. So this is what I have to say about urinary tract infections. Couple of other things. You already know that drinking cranberry juice without added sugar is pretty good. It's like an antiseptic for the bladder. The other thing that links in with this is upping your vitamin C levels, because most of us do not have good vitamin C levels, because it's actually hard to do. We have some fruit, but fruit usually has way more sugar than vitamin C. We have some veggies, but we cook them. And vitamin C is not stored in the body. The excess is secreted out in urine. So we need it every day. And without vitamin C, 1, we don't heal well. 2, our immune system is weak. So we need daily vitamin C for our immune system to be able to control new cancer cells that are trying to develop. We need our immune system to control any infections, such as urinary tract infections, because the body, when it's in a good shape, clears those urinary tract infections without going into, full-blown scenario when you need to go to the doctor and get antibiotics. So my favorite way to increase my vitamin C, which is what I do every day, I take 1 lime. I prefer lime over lemon because limes don't tend to have stones, so it's a little easier. So squeeze the juice out, mix it with cool water, drink it through a straw. The straw is necessary because it protects the teeth to some extent from the acid. And cool water, mix the juice with cool water. That's better than pouring hot water in, because hot water denatures some of the vitamin C. I do not recommend a ton of honey in it, because again, honey is sugar, and you don't want to start, I do this in the morning, but you don't want to start your day with a lump of sugar, because that'll make your insulin go high and make you hungry for the rest of the day. God forbid. So I'm just going to summarize. Preventing reinfections, we have talked about warmth, keeping warm, not allowing, our lower part of the body or any part of the body be cold, paying attention to how we feel, dressing appropriately. That may mean buying kidney warmers on eBay, buying woolen clothes, etc., but keeping warm. And please keep your children warm, please. I know they will say they don't want clothes, but you have to find a way to dress them. So warmth. Then we talked about hygiene for women. Have a shower in your intimate areas before you have sex. That prevents most water infections, urine infections. And then we talked about men. Pay attention to your urinary stream. Pay attention if you have nocturia or you have to go to toilet at night. If you have a sensation that you're not emptying your bladder, you need to see your GP, because the prostate is probably enlarging and it will start giving you urinary tract infections and maybe even kidney problems if you leave it unattended for a long time. And that's all. I hope this was useful. Sending you all lots of love. Bye.